Okay, Bret Kinsella from Voicebot. If you don't know Voicebot, then you got to go look him up, because Voicebot is the leading, what do I call it? The leading news destination for everything voice. And really, really pleased, really, really excited to have Bret here with us. So Bret, thanks very much. I'm going to jump off and I'm going to let you take it away.
Okay, great. Can you hear me okay? I don't know if you can you guys hear me? Someone say yes. Oh, yes. All right, great. Hey, Doug, what's going on, brother? Okay. So I was pretty interested to be invited to talk about this by Teri. He's a physician. I'm not an expert in healthcare, although I've done a lot of work in healthcare, but certainly not in treating patients. But I have been following this story very closely. And in fact, those of you who have been reading Voicebot.ai probably have noticed that we've done 15 stories in the last probably 9 days. And that's not because we're looking for those stories. That's frankly what's coming in. That's what's happening, which is of interest. And that's really always our editorial decision. We do have a few other stories in there, by the way. We just put something out about an assistant from Charles Schwab as well. So you should definitely check those things out. But everyone's focused on this topic. The industry is focused on this topic. And interestingly enough, there is a role for the industry to play. And that's one of the things that I've been looking at. And I was really intrigued by, Teri, some of your comments around this being a catalyst for change. I see that as well. That's one of my key takeaways right now. We'll talk about that in a few moments. And I also have seen a lot of people in our in our industry start to think about new ways that they could have an impact. And I think these are very positive outcomes for the industry. And there's a lot of activity, as we've talked about. I think you have to advance there for me, Teri. Okay, so we think we're the central source of all things voice and AI because that's what people tell us. You be the judge. We're a lot of places. Next one, Teri. I did want to point out we do have a couple resources specifically on this. Many of you attended our webinar last week around coronavirus tech in the voice industry, panel discussion, really insightful stuff. If you didn't see it, it's up on the website now, voicebot.ai/webinars, so you can rewatch that, or you can listen to it. We also have it as this week's version of the Voicebot podcast. And in the podcast version, I also answered a bunch of the questions. We only got to 2 during the panel discussion. We had a couple dozen come in. So I answered, I think 9 or 10 of the questions as just an addendum to the podcast. So if you want to hear answers to some of those questions, maybe a question you asked, just listen to the podcast. It's the last 15 or 20 minutes of that episode. We also have a previous podcast. I think Pete Erickson's on. He and Bradley Metrock and I got together to talk about what the impact would be on the event side and the community side. So all those things are out there. There's a lot of resources here, but I want to have a different conversation today. So maybe, Teri, you could push this forward and really talk about what we're doing here and why voice actually is playing a role. And I think there's a lot of things voice can do, but there's some specific things voice is doing today. So if we think about this idea of a virus and it going into a crowd, and then some percentage of that crowd has symptoms that are severe enough that they need to receive treatment. Next slide, Teri. Then what they would normally do is they would go into the healthcare system. So sometimes they'd wind up in the emergency room. Sometimes they would talk to their healthcare provider, their family physician. Next, Teri. But what we're seeing here is that the pipes, you think of those arrows, they got really fat. They're being overwhelmed at the moment. And so this is a capacity shock. We're not able to take the inbound, whether that's the physical people arriving at the hospitals or the doctor's office, or it's actually just the inbound phone calls. And so one of the things that's happened, I know a number of people who've interacted with the healthcare system recently, they tell you don't come to the doctor's office, do not come to the emergency room, call first. And that's one of the ways that they're trying to deal with the fact that they have this spike in demand and they have this capacity shock. They're not able to answer all, and even when they get to the phone, they're diverting people to these channels. They don't have enough. They don't have enough people manning their chatbots. They don't have enough people manning their contact centers to answer all these questions really quickly. So next slide. And so this is where we sort of see the chatbot come in, and the chatbot, it's more the chatbot than the voice assistant. We'll talk about both, but a tool that will help assess, do that triage for a patient, and so that so that it can determine what the best course of action or an appropriate course of action for them might be. And I think we've all seen this today. Maybe some of you on this on this session today have experienced that. I've certainly talked to a few people who have been through this. We have the humans who are answering questions, but now we have the chatbots that are answering questions as well. And that's been a tremendous benefit, because what it is it's allowing the appropriate level, or the amount of capacity that we can handle from just answering the phone, or there are other types of walk-in capabilities. And the chatbot is offloading some of that and directing people to the appropriate resources. So that's really the fundamental thing that I see. And we talk about this as conversational agents. So there is a voice angle potentially in some cases. There's definitely a chat angle. In next slide, Teri. But what we're talking about here is we have ultimately from coronavirus, it is a capacity shock across healthcare, and it has a number of different things. And so, we just talked about this idea of the inbound capacity in terms of just answering questions. That's not what we're hearing about on the news as much. We're really hearing about shortages of supplies like masks, shortage of equipment like ventilators, shortage of beds in the ER and ICU. We're talking about not enough potentially nurses and doctors, particularly ones that haven't been exposed to the virus already. So these are all big problems, and we're hearing a lot about testing. So the question here is, before we get to all of those problems, those are downstream in the value chain, we have this assessment and triage step. And that has to be done effectively before all those other things we can actually efficiently allocate resources. And I actually have a background in supply chain, so I've dealt with a lot of these things earlier in my career in great detail. Right now, one of the things that people are realizing is that if you are more effective at the front end, then you can be more effective at the back end. And we're going to focus mostly on this front end concept, but there are many other aspects of where virtual assistants of all sorts can be helpful in some of these other areas as well, about this effective and efficient allocation of resources around, as Teri said, being efficient and reducing time. And so what's happened here ultimately has been what I call the coronavirus chatbot whack-a-mole. And so it's like every day it seems like something's popping up in this new chatbot in order to help the healthcare system address coronavirus. And it's not even just the healthcare system, as we'll talk about in just a moment, but it tends to be mostly this chatbot thing. And you can forward to the next one, Teri. So let's talk about just briefly what's happening. So there's a lot of players, and there's probably some people on this call today that you're doing something, your logo isn't up here. It's my oversight. These are some of the ones that I've been tracking and that came to mind as we were pulling this together over the last couple of days. And they all are instructive in terms of things that are being done today related to conversational UI, voice assistants, chatbots. So Orbita and Hyro, for example, are both already in the voice assistant space, or the virtual assistant space, focused on healthcare. They have both brought out these free-to-use chatbots to help medical or healthcare providers handle some of the crush of inbound questions. And the idea here is they might not be able to answer every question, but they could triage a significant number of them. And for those of you who are familiar with like Google Duplex, for example, one of the use cases that they haven't quite rolled out, they've used it in Australia, a couple other places, was just being able to answer for customers what the store hours are. So sometimes you can look online, but then is the online reflect what the holiday hours are or what the coronavirus hours are? And so Google Duplex was a way for the retail site, for example, not to have to answer the phone every time someone calls around what the store hours are. That Duplex could actually answer that question for them. It could be updated in real time, always be accurate. So that would free up a significant amount of efficiency. And this is the same thing if we think about Orbita and Hyro, that what they're thinking about doing here right now is that a lot of those questions, we think about those very basic questions around logistics or details, can be answered. And that relieves the need for a medical professional to take up time to answer those questions. So that then the medical professionals can focus on the things that really do require a clinician's experience and intuition in order to handle. So that's really important. You have companies like Inference also doing this at the contact center level. They have a new solution out along these lines as well. People are moving very fast in this space, and frankly, conversational systems are very flexible. So as long as you have a knowledge base that you can add to them, they can be trained very quickly to be effective for this type of thing. And so what we're seeing is all this work, this groundwork that's been done for the last couple of years around conversational assistants of all sorts is now being shown how quickly it can have an impact. And that's something that I think should not be lost on us here. So there's a few things that we see that are very specific, and chatbots being delivered, and isn't that great? But if you think about previous technology cycles, I mean, how long would it have taken for someone to roll out a new mobile app in order to solve some of these problems? We wouldn't have moved this quickly. And for something like a pandemic like this, which has such a rapid trajectory, being able to deploy systems that are customized to the moment and the context is something that's unique to these AI-based systems. Some other things we're going to, I think, hear later from Voicebot.ai, but there's also a company out of Poland, Tecmo, which Mikhail Stanislawik, who's on today, pointed out to me. What they're doing is around diagnosis, trying to interpret the way you speak and the vocal signature, and to determine whether you might be at a higher risk and need testing, or at least need to talk to a medical professional. Another type of triage is actually potentially before you even go to your healthcare provider, or maybe an added value solution that they could provide. RX Health is actually being a little bit more ambitious, and they're saying it's not just the voice assistant or the virtual assistant, but they also have telehealth aspects that they are implementing. And I know that a number of people who had never been on telehealth medical appointments before had them over the last 10 days because that was the only way they could get them. So there's a lot of these changes going on. And just to extend this, let's talk about the topics that we often discuss around these voice assistants, the common consumer voice assistants. Google Assistant, Apple Siri, Amazon, they all have taken steps along these lines as well. Now, one of the things I want to talk about is in terms of the general purpose voice assistants is how they're serving, because Apple has taken a very different approach to Google and Amazon. Apple actually has implemented a triage type solution that you might have from a voice bot, a chatbot like Orbit or Hiro is developing. And it's based on the CDC and the Department of Health and Human Services guidelines, where we'll go through, and if you've read the story that I wrote about it over the weekend, or you've had a chance to check it out yourself, you can go through and you can have a sense of what the tree diagram is that they're trying to implement. But if you think about it, what Apple decided was that this is really important to people. It's on their minds. They're not making an affirmative diagnosis, but they're helping people understand, based on what their symptoms are or lack of symptoms, based on what behaviors that they've been engaged with recently, what their level of risk is, and what some appropriate next steps might be. All the way down to it'll actually execute a 911 call for you if you're in severe respiratory distress, for example. So, Apple has really stepped forward and said, hey, this is something that we can do. And I think that's interesting that they've done that, because that came after both Google and Amazon actually stepped back from what they were doing. And I say stepped back because a couple of things. We're the first to report on both of these incidents, where Google about 10 days ago and Amazon within the last week pulled all the third-party actions and skills related to coronavirus. Now, I know Teri's was one of the ones that was impacted by this, and we might think about Teri versus somebody else in term. He's a practicing physician. There's a standard of care and expertise there. Should his flash briefing have been pulled the same as maybe some of the others out there that were just providing maybe stats, maybe tied into Johns Hopkins CSSE tracker or something else, or Worldometer, which I think one of them was connected into. To me, I stepped back and I paused and I understood why Google and Amazon said they were doing it, because they were worried about false information. But they were also removing access to correct information. So we could talk about that a little bit later, but I really feel that it wasn't necessarily a great service, given that if it's part of your flash briefing, you're getting information every day, and then to pull it and not to replace it with anything. Now, since then, both companies do have answers for Alexa and Google Assistant to coronavirus, but it's very basic, top-level information. It basically says, go to the CDC or go to your government website in order to learn more. And I guess that's okay, but it seems to me that it doesn't rise to the moment. Google has stepped up a little bit more recently, where they do have, through Assistant on the phone, they do have this interactive capability where it shows news and some links to government websites. And I think that's helpful. That's another thing. And Google also has Verily, which is a division which is providing information about testing and essentially top level triage. But that's only available in certain communities in California right now. So I think there's question about policy, which we'll mention in a few minutes. Microsoft has been much more aggressive and really was well positioned for this because it has a healthcare bot, which is based on the Microsoft bot framework. But think of it as more of a packaged solution. And that's in the field right now. There were a couple places like Providence who just modified what they had, and with a Microsoft healthcare bot that they already had, and they added coronavirus content to it. CDC deployed something like this just over the weekend, and so you can go to the CDC website and interact with this. These are important things that are saying, hey, we've got an enterprise class solution that people are already using, that they already trust, and they're basically able to repurpose it to meet the needs of the moment and to have that much more robust interaction that I think we expect from assistants at this point. Just a few other things I'll point out. Voicify has a new solution out for state governments. I think we often overlook the idea, because we think so much about healthcare, we're overlooking that state governments are really a key player here. Anybody who's watched the news, and maybe they've seen Governor Andrew Cuomo from New York talking, or Governor Larry Hogan, or Governor Gavin Newsom, depending on what state you're in, you probably have seen them out there. The states are getting a lot of inbound questions. They're getting them from providers, they're getting them from citizens. And so how do they handle that crush? They also have this capacity shock from citizens asking questions that they haven't asked in the past, just like the healthcare system. So Voicify has something that they've just rolled out free to state governments that they can implement to be able to answer some basic questions. They say they can get people enabled within a day, and it's free. So, another constituency that's been impacted significantly by this. And another, Satisfy Labs has something out as well. They work with event venues. Think about Broadway theaters or other types of performing venues who are getting a lot of questions right now, much higher level. I think that the statistic I said is that the inbound inquiries just around frequently asked questions around COVID related items, cancellations, when are they going to be open, ticket refunds, all these things are up, depending on the venue, 10 to 20x. They can't handle all of those from a phone call standpoint. They can post on the website maybe, but this is a way for them to also triage that inbound capacity shock. Okay, so I talked about a lot of stuff right there. Let's move on to the next slide and try to get to a couple key points here. The other thing I wanted to point out was there is a difference in the roles that we're seeing, the chat and the voice angles here. What we're seeing is the chatbots, by and large, are being customized, and they are really focused on the task and often the triage task. Sometimes just answering Q&A, but often taking some additional step as well. And they're really well suited to that, because basically you can just roll up content in a rules-based system very quickly. You do have to do some training to the model, but not as much as you might with voice. Right now, the voice assistant solutions are less differentiated. They tend to be more general and generic, and they are, as opposed to task-oriented, they tend to be information-oriented. So they are providing information more in that FAQ perspective and pointing the users to these other systems, which may wind up at a customized chatbot. I'll put that into context for you in a moment. Keep going, Teri. And I will say that, interestingly enough, the timing for this was right from a consumer perspective, because we did an analysis or research project last fall, and Orbita sponsored that. It was great to collaborate with them around this. We were trying to figure out how many people had used a voice assistant, some sort of virtual agent, to interact with a healthcare provider, and how many wanted to. And what we found is over half of consumers were interested in using some sort of agent in order to interact with healthcare, but a very small percentage had. And a lot of that's just availability. So what we found is that the demand outstripped the supply, And so we didn't have a situation over the last week where some of these chatbots are coming out that people are saying, hey, I'm not comfortable with that. I've never thought about that. I don't even know if I want to do that. In fact, what's happened is over half the population has already decided that they would like to have some of these capabilities. And now what we're seeing is because of this shock, this pandemic, and the need to act quickly, healthcare providers, which typically move very slowly, are moving much more quickly and providing some of these services that consumers are absolutely ready for. Okay, so let's go to the next. And we'll just to point out, I won't belabor this point, but the number one thing people have done with a voice assistant around healthcare is ask about symptoms. And the number one thing that they want to do going forward is ask about symptoms. And so we think about these triage capabilities. This is exactly what consumers are ready for and what they're looking for, because they find that to be a much more efficient way to get immediate feedback from the system, and something hopefully that they trust. And this is a problem with healthcare provision today. If it's always person to person, it can be a long time, can be days or weeks before you get a chance to get actually direct feedback. And that could be really important to how you care for yourself and how you execute your day-to-day life based on whatever that knowledge might be. Okay, next, Teri. And I just want to put this into like broader context, just a couple of quick things. Many people who have seen me speak at conferences or maybe our Voice Insider subscribers are familiar with this idea that I talk about this whole market being large. We've got this idea of general purpose, niche, owned, and white label solutions for the market. And if you hit the next one, Teri, and if we think about Siri, Alexa, Google Assistant, they're all in the upper right-hand quadrant. It's broad feature scope. It's controlled by the platform. If you're a third party, they can rip you off at any time, and replace you, shut you down. But they do provide broad reach, and they do provide a lot of access to a wide variety of resources, particularly in this case, first party, and sometimes third party at their prerogative. So that's one. And then if you keep going, Teri, and if we look at coronavirus, we have all those players also playing a role at different levels. We talked about the Apple approach versus the Google Assistant or Alexa approach. And we also have WhatsApp being a really popular platform. We saw something roll out a couple days ago in India, WhatsApp Messenger to answer coronavirus questions. Just today, I think in the UK, the same type of thing rolled out. And then we have these other areas. We have sort of these niche solutions from Voca and Tecmo that are working on that could, I would say they're not in production yet, and maybe we'll learn more in just about 30 minutes or so. They could provide this additional type of information for both providers and for patients along these lines. But then we have the below the line. And this is the world of the custom assistants. These are the things where if you are Providence Healthcare, you can customize the healthcare bot from Microsoft in order to answer some of these questions that are coming in that crush. And we talked about all those other providers in that space that are doing this. And in the lower left, we have this pure custom thing. We've got Microsoft Bot Framework, where it's not just a template, whereas this white label quadrant where you can configure things. Over on the left, you can just sort of create what you want in that type of world. And this is the type of thing that we'll see. And I'm sure there's many more logos that we could put up here, but this is just a sampling of saying, hey, these are the different ways a conversational ecosystem as it exists today is having impact and can have impact on voice. And this is a way to think about how they're doing things differently. And we'll go to the next. And one of the things I want you to think about is on the top half, they tend to be channels. So it's not necessarily something that you as a provider or healthcare organization can customize, but they are channels that can actually do specific things for you and potentially bring some consumers or patients into your area. And what we're seeing is most of the news, most of the activities at that capabilities layer. So it's all this customization, whether it's white label or it's your purely bespoke solution that you have in that lower right. It's this idea of people saying, hey, we're going to deploy a new voice interactive or a conversationally interactive capability that goes above and beyond those channels. And in fact, what you'll find is many of those on that lower part have nothing to do with the consumer voice assistants through smart speakers or smartphones. They have to do with mobile apps and websites. right? Because those are the things that everyone can enable today. Those are or have access to today. Those are the things that aren't necessarily platform controlled as much. You have much more flexibility about what you can deploy. And those are the things, therefore, you don't have to worry about what a platform provider is allowing you to do. You can much more effectively go and say, hey, I have a direct connection with these patients, and this is how I'm going to serve them. So we go to the next thing, Teri. And just in terms of an impact of how we're moving forward, I would say that the key takeaways that I'm expecting out of this is this chatbot revival. A lot of us have observed over the last couple of years that the enthusiasm around chatbots had waned significantly. What we're seeing, though, is the capabilities are actually there and are very helpful in certain situations around supply shocks. That's going to turn people into thinking about this more as an everyday type of solution, particularly as consumers become more familiar with them. So I really expect chatbots to have a bit of a renaissance here, even beyond healthcare, but particularly in healthcare. Also with voice assistants, I think this policy of the consumer voice assistants about how they're going to interact this. Are they more worried about the legal repercussions of saying something wrong or having a third party say something wrong? Or are they going to be much more focused on just making sure that the information is out there and they can be helpful, and how they're going to balance that? Because they had to work very quickly. We see they took some steps. Maybe they're going to backtrack. Maybe they're going to change it. But as we move forward, this idea of policy and how they're going to handle this is going to be really important. Absolutely, Teri said this, healthcare changes from an operational standpoint. You go back up, Teri. Healthcare operational changes based on this. Healthcare resists change until they have to move forward, and there's a lot of reasons why they have to move forward. In this time, the catalyst is the pandemic. So as they implement chatbots, as they implement telehealth, it's going to be hard for them to just ignore that going forward. That's going to become part of something that we would expect. I have a feeling there will be a pullback from that for a little while as they say, oh, we need to make sure this is up to standard and we need to incorporate it. But it's really not an if, it's a when in terms of telehealth, chatbots, voice assistants, and healthcare at this point, because we're already seeing the positive impact that they can have. And the last thing I'll say is we're going to have this rethink around China. And not just the supply chain, but also this is going to impact how the technologies that we're using, both at the device level, also at the AI software level, because there's now this concern about what's happening coming out of the country, not just in terms of the pandemic, but in terms of how they're interacting with some of the different supply chains and what that means for sovereignty and the safety and the flexibility of these governments to act in the time of a pandemic. And I'll be the first one on this session to say Black Swan event. So just to finish up, if you want to learn a little bit more about what consumers are saying about voice assistant use, just go to voicebot.ai/research. We have a 30-page report with 20 charts on what they said, and it really talks about that adoption curve. And so, Teri, I know we're right up at 3:00. If you want to take one or two questions, I'm happy to do that.
Yeah, we're thanks, Bret. Here can see you're the expert when it comes to an overview of the industry. You're so knowledgeable. So I really appreciate that overview. Fantastic. We are right at the top of the hour here. I saw one question that came up. Maybe I'll just get you to answer that one. It was this one I saw. How do consumers know to use voice to take advantage of this?
It's interesting. I don't know that consumers were told to do this. They've just been doing it. I mean, this is what happened ultimately, is that people are using voice assistants on a daily basis, and they ask all sorts of questions. So why not ask for this? And I think that's one of the things, but there's a fundamental point that if we're going to use these more frequently, and if they are going to be important resources, we do need to raise awareness about that. And so the news media has been covering some of this availability with the CDC bot, but there's going to need to be a proactive outreach to consumers to say, you don't have to call your healthcare provider. You can go to the website and use the chatbot first, and that can get you there faster. And I think we'll see that in the call centers when they call in. They say, if you don't want to wait, for the 32 minutes until the person's available, you can go on the website or the app, and you can get this interaction. I expect this will be a way to raise awareness about these capabilities, and will start to change consumer behavior, that they might start to expect this, they'll go to the mobile app, they'll go to the website to see if the chatbot can help them first, just as some people do for customer service today. And that's important now for healthcare, because healthcare hasn't had that capability. You always had to do the phone. Now that this is coming about, not only will it change the practices, but it's going to raise awareness that this could be a benefit from a healthcare provider going forward. Great question, though. I'm glad someone asked that.
Great. Thanks so much, Bret. I really, really appreciate you taking the time. Fantastic. And, we can always continue the conversation there in the chat as well. So, Bret, big thanks. And everybody should
hit me up on Twitter at Bret Kinsella.
There you go. Bret Kinsella on Twitter, and check out Voicebot.ai. All right. Awesome.